Dr. Gupta, let me ask you, if I can, about where we are right now in this pandemic. And I want to put a chart up on the screen for folks to see right now. This shows the United States, it shows the European Union, it shows Canada, and it shows Australia. The U.S. there in black is the one with the peak, again, at the end. So I guess as you look at this, you see the bell curves for those other locations. You see us with this plateau after the first peak and now a rise once again. How can the vice president, how can this administration argue that we have flattened the curve, that we have slowed the spread when you see these figures in front of you?
Peter, I wish I could explain the rationale in terms of messaging and help better understand for the American public, translate what the vice president's thinking. But I can't, because it's unthinkable. That graph that you're showing right there is part of a larger story, which is that the infection growth rate for coronavirus is increasing in 32 of 50 states nationwide. And unlike in March, when I think most of us took this seriously, the broader American public, now you're seeing an Axios poll showing that 4 in 10 Americans are wearing, in the Mountain West, masks when they go out in public. The highest rate of mask wearing was in the Northeast is 64%. We know that masks are only effective if 9 in 10 individuals wear them nationwide. So there's an attenuation of public will and cooperation with what we know is going to work. We have awful messaging on personal individuality and free speech from the president and the vice president today. Bad behavior modeling. They don't ever wear masks in public. And this is the explanation here. So you're having a public that's just not willing to deal with it anymore at scale. You're having worsening statistics, as you just showed. So what we're going to see here is we're going to see ICU beds fill up. I was just in the ICU a few days ago. That's what I saw. You're seeing that in Houston. You're seeing that in Arizona. You're going to see it in California. So we're in a much, much more dire situation than we were back in March, because we need public cooperation. We don't have it. We need federal leadership. We definitely don't have it.
And Dr. Gupta, you made the point about masks that I would make as well, striking. A lot of people noting the vice president today, though given the opportunity several times, urged Americans to pray, but never urged Americans to wear those masks that you say can only Americans are doing it right now. One of the other arguments this administration has made is that the reason we're seeing the cases go up is because the tests are going up, but that ignores the fact that the infection rates are rising rapidly as well, to say nothing of what's happening in hospitals. Is that a sort of a fair assessment?
I mean, Peter, this is all a distraction. It's all distraction, so we aren't talking about things that matter. Here's the thing. To your point, the infection growth rate's rising. That's all that matters. Hospitalizations numbers are increasing. ICU beds are being taken up in very dense populations across Texas and Florida. That's all that matters. Americans are potentially going to lose their life because they don't have access to health care. But here's a metric that I want your viewers to really key in on: the number of tests per confirmed case of COVID-19. We test 12 individuals per confirmed case. Countries that have gotten this right, New Zealand tests 270 individuals per confirmed case. Estonia, about 70. South Korea, about 90. That's what matters here. The test per confirmed case. We still have too narrow of a focus on our testing. That's why the administration wants to talk about aggregate numbers. It matters who you're testing and how much. We're just still not doing enough. That's what the facts say, and that's what we really need to focus in on.
And AB, let's bring you in here as we look at some of that sound we played from the president at the beginning, again, sort of downplaying the situation, saying that, it's all because of testing at this point, saying that the threat is not all that significant. He said, I can't name how many times that I've been in the White House in recent weeks that it's either dying out or fading away or the like right now. But it becomes increasingly clear that this sort of defiance, stunning as it may be right now, is putting the president in this position where he is, as we noted, on an island right now, where the cases keep surpassing him, and he wants to focus almost exclusively on other things, most notably the economy.
Right. Dr. Gupta put it nicely to say that it serves as a distraction to say that an increase in tests is producing new infection reports. It's gaslighting. I mean, with the surging in hospitalizations and positivity rates, this is a dangerous thing to do. And the president has done this all along with testing. Dr. Gupta also talked about these other countries and testing per capita. We're still not testing our population. I checked this morning, we're still behind 25 other countries, a huge improvement from 2 months ago, and we were behind 48 The president says we're the best in the world on testing, and the only thing you're seeing on TV is an increase in testing. The idea that this administration has anti-mask testing regimen and anti-federal authority in contact tracing is so alarming. We've forgotten to be outraged about it. And when you see Vice President Pence, who Peter, clearly was trying to walk a line today, where when he was asking for prayers, you could see how earnest his pain was, but he could not even say the word mask. He'd use, cloth face covering or something, because he has to toe the company line. What's an amazing thing to see this afternoon is that not only Mitch McConnell, the Senate Majority Leader, and James Mattis, the former Defense Secretary, and the former Vice President, Dick Cheney, they're all out saying something on masks, basically saying, in essence, to the public, we're in so much danger now, this is spiraling out of control, and the president has forfeited his responsibility to lead on this, that we're going to do this PSA on masks. I think that says it all.
Yeah, Liz Cheney, the daughter of the former Vice President Dick Cheney, even tweeting a picture of her father wearing a mask with a hashtag that said, "Real men wear masks." Peter, what struck me as much as anything today was the fact that this briefing even took place. Now approaching 2 months since the last one. As we said from the start, there have been 70,000 more Americans' lives lost in the course of that time. What do you make of the fact that it happened? Does that acknowledge that there's a serious problem, as Dr. Anthony Fauci said today? And also the fact that it happened at HHS, the health department, as opposed to at the White House. Does that have anything to do with the fact that they don't want the president to be a part of these?
Yeah, I thought that was actually in some ways the most notable part of it. We went through briefing after briefing, night after night, with the president of the United States for weeks on end, 5 o'clock more or less, because the president was at that point taking it seriously to some extent anyway, and presenting himself as the major voice of the government and the nation in our fight against this invisible enemy, as he called it. But yesterday or today's briefing, he didn't want to be a part of, obviously. He could have if he chose to. He chose not to. It wasn't at the White House. It wasn't involving the president. It was at HHS. The president was going to go to Bedminster for the weekend, chose not to. A state, New Jersey, that's telling people from out of state not to come unless they've quarantined for 14 days. And so you see a president who just doesn't want to be the face of this anymore. He doesn't want to be focusing on this. He doesn't want to be associated with this. And it's a remarkable shift in the sense. At least in March and April when he was doing these briefings, he was questioned day in, day out by reporters. He didn't always give the answers that public health experts would have given. But you asked him a lot of questions, Peter, that went to the heart of this issue, and he was forced to answer them or not answer them as he chose to. Today, he wasn't even willing to come out there and confront what's happening in so much of the country, including and especially in red states that support him.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.